It's Dr. Ryan here. I hope you and your family are well. Today we are tackling a problem which is crippling society as we know it. We're talking about the metabolic syndrome. All right, so I am a physician right here in KwaZulu-Natal in the heart of South Africa. And as you can tell, I'm an Indian guy. So I thought we could tackle this from the practical, pragmatic standpoint of a South African Indian. All right. So this is the talk outline. We're going to be talking about metabolic syndrome, the concept of this, and how it ties into our charo culture. Charo is a colloquial term for Indian in South Africa, right? And you can see how this is kind of like a vicious cycle, that our culture predisposes one to develop metabolic syndrome. Then we're going to talk about the phenomenon of atherosclerosis, a pathophysiological term, and how this contributes to heart disease and cerebrovascular events. Then we're going to touch on primary prevention of cardiovascular disease and how we can lower our cardiovascular risk. And we're going to hone into 3 specific points: a heart-healthy diet, exercise, and coping with stress. We're going to touch on smoking, and then, of course, as always, I'm going to encourage you from the Word of God. It's just some stats from the WHO, that's the World Health Organization. World Health Organization, okay. So the world's leading causes of death in terms of total number of people who have died in the millions, right? In 2019, the leading cause of death by far was ischemic heart disease, followed by stroke, right? So these are 2 prominent cardiovascular events, all right, that we are going to be talking about how to lower our risk for. Of course, chronic obstructive pulmonary disease comes in thereafter, which is associated with smoking. We're also going to touch on that. According to the World Health Organization, the top projected causes of death by the year 2030 will be number 1, HIV/AIDS, number 2, ischemic heart disease, number 3, depression. The 3 biggest killers projected by the year 2030. And we see the increased prevalence right now, that worldwide obesity has tripled since the year 1975. All right, and in 2016, more than 1.9 billion adults were overweight, and 650 million were obese. And we look at how the WHO defines weight categories of overweight and obesity, and approximately 537 million adults aged between 20 and 79 are living with diabetes. The total number of people living with diabetes is projected to rise to 643 million by the year 2030 and a whopping 783 million by the year 2045. So this is a global health problem, everybody. According to Stats SA, in South Africa, 215 people die every day from heart disease or stroke. And every hour in South Africa, 5 people are having a heart attack. 10 people are having strokes, and of these events, 10 people are going to actually demise from that. So, you know, they say a picture speaks 1,000 words. Right? So this I got from the website ladbible.com. So what can we see here? Let me get my handy pen. Alrighty. Okay, so we see quite an obese gentleman, right? So he has one hand on his smartphone and the other hand on the remote of his TV, watching some entertainment, right? And then he's feeding himself with a whole lot of fast food. So what we can see here, some famous franchises which are mentioned, right? And then he's also got this famous brand of cool drink he's having an infusion of. And the irony is that this is causing obvious pathology in his life. But instead of changing his lifestyle, he opts for a whole variety of medication. And that is why we say, ladies and gentlemen, that cardiovascular risk is determined by your lifestyle. So, a major part of the problem is primary prevention and leading a healthy lifestyle. And we'll talk about that. All right. Coming closer to home, us as charos, which is South African Indians, we're very fond of using a whole lot of oil in our meals, preparing these sumptuous curries, which unfortunately are very high in saturated fat content. So this is a famous brand of sunflower oil. This is here's some youngsters enjoying hookah, right? This is our traditional sheephead curry. In Tamil, we call this atale, right? Which, as we know, is rich in cholesterol. Okay, the bad cholesterol, the LDL cholesterol. This is a famous brand of soft drink. This is somebody who is consuming a whole lot of beer. All right. So I just want to demonstrate the phenomenon of atherosclerosis. All right. So you can think of it from a conceptual perspective as being a plumbing problem. So all of us know that we have vessels in our body, and this is an artery, a normal healthy artery, made up of three different layers, right? The tunica intima, the tunica media, the tunica adventitia. But in the tunica intima, which is the innermost layer, and this is the lumen, of course, what happens is that if you have cardiovascular risk factors, you may cause microtrauma to the tunica intima. And as a result, you have foam cells, which are essentially fat-laden macrophages, which come in, right? And they form a fatty streak. And then eventually what you have is fatty material being deposited in the vessel wall. But what's happening to the inner aspect of this tube, which is the lumen, it becomes narrower and narrower and narrower. And what happens is if a clot were to form, right, that will completely occlude that vessel. And then that organ that the vessel is perfusing is going to become ischemic and infarcted because there's lack of blood supply. And of course, blood, as we know, conveys oxygen and nutrients and takes away carbon dioxide and waste. So that organ of interest is going to die. And that happens, if that happens in the heart, we call it a myocardial infarction. If it happens in the brain, we call that a stroke. If it happens in the kidneys, a renal infarct, and so forth. So these are the criteria for the diagnosis of the metabolic syndrome, all right? The main characteristics. So WHO and the International Diabetes Federation dictates you require 3 out of 5 for a definitive diagnosis of the metabolic syndrome. So in terms of blood pressure, we're looking at a systolic of above 130 and a diastolic of above 85 moles mercury, or if the patient is, or if you yourself are currently on treatment for hypertension. Then in terms of waist circumference, we speak of men having a waist circumference in excess of 102 centimeters and women more than 89 centimeters, but we see that this also is determined by the ethnic origin, and we'll have a look at that on the next slide. Fasting triglycerides, a value of above 1.7 millimole per liter, or if a patient is on treatment for hypertriglyceridemia in the way of fibrates and statins. High density lipoprotein cholesterol, HDL cholesterol, is the good guy, right? There's a high proportion within the chemical structure of protein compared to actual fat. The HDL cholesterol is desirable, it's something that you want, right? So if that value is below 1 millimole per liter in men and below 1.3 millimole per liter in females, that forms one of the criteria for diagnosis of metabolic syndrome. And of course, if we look at the fasting glucose, a value in excess of 5.6 millimole per liter fasting, right? Fasting. Or if you're on treatment for that in the way of diabetes. So 3 out of these 5, everybody: blood pressure, waist circumference, fasting triglycerides, HDL cholesterol, fasting glucose. 3 out of the 5 makes a diagnosis of metabolic syndrome. So yeah, we'll talk about the racial origin and how that plays a role in the diagnosis a bit later on. So this is atherosclerosis, showing us what a normal artery looks like in longitudinal section, and we show how the lumen gets progressively obstructed by formation of atherosclerotic plaque. All right, so there's narrowing that happens. Okay, complications of hypertension. We know, everybody, that there is a genetic basis for this, but hypertension itself, in terms of the sequelae, it can cause a stroke, it can cause hypertensive retinopathy, so you end up with visual changes, peripheral vascular disease, so limb ischemia, can cause renal failure, and it's one of the leading causes of renal failure worldwide. It also impacts the heart in the way of hypertensive heart disease, which leads to left ventricular hypertrophy. There's risk factor of coronary heart disease, and it's one of the major role plays in terms of contributing to heart failure in our populations. Complications of diabetes mellitus, we know it causes it increases your cardiovascular risk and increases chance of a cerebrovascular accident. Eye damage, something we call diabetic retinopathy. It plays a role in contributing towards coronary heart disease, can cause nephrosclerosis or kidney damage. And we know that the leading cause of renal failure worldwide is indeed diabetes mellitus. It can cause peripheral neuropathy, and in fact, it can cause a whole variety of problems with your nerves, and of course, diabetic foot sepsis and diabetic foot. So then, everybody, look at how do we determine your cardiovascular risk? So we split them, we certify them into non-modifiable and modifiable risk factors. So unfortunately, non-modifiable refers to factors in your life that you cannot change, right? For instance, you can't change your age, can you? No, age only goes one way, that's upwards, right? Your family history of cardiovascular disease, if you have chosen your parents poorly, Unfortunately, we don't dictate who our parents are. But if you have a family history of cardiovascular disease, that represents a non-modifiable cardiovascular risk factor. If you had a previous cardiovascular event, be it a stroke or myocardial infarct, and of course, sex, right? But things that we can change in terms of modifiable risk factors are your blood pressure, your blood sugar, so glycemic control if you're diabetic, your body mass index, chronic inflammation, your diet, how often you exercise, and aerobic physical exercise has proven cardiovascular benefits, your high density lipoprotein cholesterol, smoking cessation, managing your stress better, managing your cholesterol better. Then, of course, social factors are also known to play a role. Alrighty. So this is just touching on the diagnostic criteria for metabolic syndrome. I just wanted to draw attention to the fact that the waist circumference criteria is also ethnicity specific. So in our demographic, speaking to Asian people, if you're a male and your waist circumference is greater than 90 centimeters, and in women, greater than 80 centimeters, that forms the diagnostic criteria, one of the diagnostic criteria for metabolic syndrome, right? Versus if you are of sub-Saharan African origin or Middle Eastern men, it tends to be slightly more relaxed if you're a male, right? But the other main players in the game, like we mentioned in the previous slide, is fasting triglyceride level, HDL cholesterol, blood pressure in excess of 130/85, and a fasting plasma glucose of about 5.6 millimole per liter. Okay, now the waist to hip circumference. There's an age-old debate about the body mass index and whether it is indeed a reliable predictor of cardiovascular risk, because a lot of people, a classic example is if you do weight training, right, and you're bulking muscle weighs more than fat, right? So by looking at the BMI specifically, that's not necessarily going to tell you about cardiovascular risk per se, because muscle weighs more than fat. So if indeed that be the case, then instead of relying on the BMI, you can rely on the waist to hip ratio. So what is the waist? The waist represents, simply put, the narrowest diameter between your lowest rib and the pelvis. So essentially A here is your waist, and the hip represents the widest diameter between your ribs and the pelvis, usually around the bums, right? So the buttocks. So a healthy waist to hip ratio if you're male is 0.9 or less, and for females 0.85 or less. Alrighty. So good question, nice to ask, right? How do I reduce my cardiovascular risk? We're going to be touching on each of these points specifically. So eat a healthy diet. Get regular aerobic exercise, at least 150 minutes per week. Limit your alcohol consumption. Lose weight if necessary and maintain a healthy weight. Find healthy ways to manage stress. Get assistance to quit smoking and avoid secondhand smoke. And manage your comorbidities like diabetes, high blood pressure, and your dyslipidemia. Okay, so let's talk about diet for a while. As we know, the guidelines or recommendations depend on evidence, which are robust studies which have been carried out. And there's varying levels of evidence. There's randomized, double-blind, placebo-controlled trials, which are the highest level of evidence. Then we get case-controlled trials, we've got cohort studies, we've got descriptive analysis, and there's a wide variety of studies. But essentially, the guidelines and recommendations are based on these. Now, whenever there's low evidence, it's easy to argue for or against a particular intervention. So the truth, everybody, is that nobody in history ever took two populations, population A and population B, and put population A on one island and fed them only fats, and population B and put them on another island and fed them only carbs for 30 years, and then came back thereafter to see who's alive and who's dead. There hasn't really been a study to prove that. So therefore, in regards to diet and cardiovascular risk, it's somewhat of a low evidence zone. So you can argue for or against particular kinds of dietary interventions. And as we know, there's a whole truckload of diets out there. The Atkins diet, the DASH diet, the Banting and the keto diet, intermittent fasting, and so forth. Right? But I want to tell you that I am definitely not a dietitian, not by any stretch of the imagination, right? But I will advocate what is recommended for good heart health as per the American Heart Association and the European Society of Cardiology. And that is what we're going to cover in the next slide. Sorry, got a frog in my throat. Right, you want to firstly decrease your saturated fats and your trans fats, right? So trans fats or saturated fats is basically any kind of fat that if you were to put it in the fridge, it becomes hard, right? A classic example is cooking margarine, right? You put it in the fridge overnight, it becomes hard. That's an example of a saturated fat, right? There's no double bond within the structure, the chemical structure of that particular fat. So ideally what we want to do is use mono or polyunsaturated fats, okay? Mono or polyunsaturated fats. And the classic examples are olive oil, canola oil, nuts and seeds, avocados, and fatty fish, right? And the second thing is you want to increase your intake of fresh fruit and veggies, okay? And we speak about a rainbow of colors because this provides ample antioxidants and B vitamins as well as a good source of dietary fiber. The third point is you want to eat more fiber in your diet, right? Which keeps you regular and also decreases your LDL cholesterol. You also want to substitute animal protein with plant protein, right? As we know, beef, pork, and chicken with skin and dairy means higher fat and more cholesterol. That increase your frequency of meatless meals. And if you're going to eat meat, you rather opt for white meat rather than red meat. The next point is to get regular aerobic exercise. So the American Heart Association recommends a minimum of 30 minutes of aerobic exercise 5 to 7 times per week. Now, for many of us, this seems like quite a bit, right? But consistency is a currency. So if you start for at least 5 or 10 minutes every day, be it jogging or be it rowing or be it swimming or be it cycling, whatever it is, and you do it progressively and stick at it, eventually you will be covering at least 30 minutes 5 to 7 times per week, right? Lower impact examples include swimming, cycling, orbit trek, walking, or rowing. Higher impact includes running, jumping rope, step aerobics, and there's of course numerous benefits to physical exercise, right? It improves your general conditioning, it lowers your blood pressure, it increases your high density lipoprotein or so-called good cholesterol, helps to regulate your glycemic control, promotes weight loss, decreases your resting heart rate, and improves lung function, right? The third point is effective management of stress. Now, symptoms of stress you may recognize in yourself or in a loved one is anxiety, depression, or panic attacks, chest pain or palpitations, fatigue or insomnia, frequent headaches, high blood pressure, indigestion, all right? And the complications of poorly managed stress is that some people turn to substances to control their stress levels or to help them to deal with whatever is causing them anxiety. Some people opt to alcohol and smoking. Some people eat too much. Some people abuse substances. So stress coping mechanisms, just to mention a few, relaxation techniques. Number one, it's good to laugh, right? Because laughter, as the Bible says, is good medicine, right? And also laughing produces endorphins, which are the feel-good hormones, and they also help to reduce your cortisol level. Calm your mind by reading, by meditation, as opposed to medication. Ask your partner to give you a lovely massage. And deep breathing exercises. Then you can offer physical techniques in the way of becoming more physically active, eating a heart-healthy diet. So we already spoke about that. Cut down on your fatty foods, especially before bedtime. Cut down on your caffeine and your sugar. Improve your sleep habits. So turn off electronics when it's time to go to bed. Unwind with a book or a warm bath just before you go to bed, which is going to help you to fall asleep. Make sure you have a very dark environment conducive to sleeping and a soothing environment, peaceful. Stop using substances, right? The third means of controlling stress effectively is what we call cognitive techniques. So if you're a journal person, you can keep a journal and just write down each of the day's events and accomplishments and things you are grateful for. Make sure you make time for yourself. Try to do one thing every day that is just for you. May it be a hobby that you enjoy, reading a book or going for a walk or meeting a friend or something, right? Thirdly, share your feelings. Whenever you're feeling overwhelmed and anxious, connect with a friend or a loved one. Hearing a voice speaking into your situation can help. Fourthly, take control. So if you have 101 things to do, it's always good to make a list. And now there are a variety of smartphone apps out there to help us to better manage our time. And as you accomplish each one, just tick it off and tick it off. And then it helps you, have a sense of control and progress throughout your day. And of course, if everything just seems too overwhelming, it's good to consult a professional, right? So essentially, you need to know your ABCs, right? If you're already on treatment for a previous ischemic event, you want to be taking your aspirin, you want to control your blood pressure, make sure you're taking your meds, control your cholesterol, make sure you're taking your statins and your fibrates, diabetes control, so make sure you're taking your oral hypoglycemic agents, right? Or your insulin, whatever it is. And then make sure ease for exercise. Remember we said the recommendation from the American Heart Association is at least 30 minutes of moderate intensity aerobic physical exercise 5 to 7 times per week. And by moderate intensity, we mean that as you're doing the activity, you can actually maintain a conversation with somebody. So you're not so out of breath that you can't do that. F speaks to fat reduction. G, get to quit smoking. So there you are, guys. A, B, C, D, E, F, G. Aspirin, blood pressure control, cholesterol control, diabetes, exercise, fat reduction, get to quit smoking. So in short, everybody, eat less but eat right, number 1. Number 2, exercise more frequently. Number 3, drink more water. Number 4, manage your stress. Okay. Just a little note about smoking. So this is post-autopsy, essentially, and we are looking at 2 sets of lungs. On the right is pink healthy lung in a non-smoker. In the black, needless to say, is the lungs of a chronic chain smoker. And you can see the tar-filled, nicotine-filled, pathologic lung that is there, right? And we know that every box of cigarettes comes with a handy slogan, right? And these are warnings for us. Smoking does indeed cause blindness. Don't let your children breathe your smoke. Smoking causes mouth and throat cancer because smoking has a whole variety of negative effects, including respiratory disease in the way of chronic obstructive lung disease, and it predisposes to lung cancer, right? It contributes to heart disease, negatively impacts fertility, it can cause retinopathy and eye disease, it can even cause periodontal and gum disease, and yes, indeed, smoking can increase your risk of diabetes mellitus, right? This is an article which was published from the Environmental Health Journal, and it looks at the effect of hookah or water pipe smoking on general health and the cardiovascular system. And the abstract of this article reads as follows, that hookah or water pipe smoking is an emerging trend among the youth. The attraction of this is the misperception of it being, quote-unquote, less harmful than conventional cigarettes, and there's a wide variety of flavors to choose from. However, hookah smokers are exposed to the very same toxic compounds as our cigarette users, but only at dramatically higher levels because there's no filter, leading to significantly ill effects on health. It represents a major source of tobacco addiction, which is nicotine, which is variable in type and amount among hookah users. Okay, so everybody, I'd just like to give you a little bit of homework, not much. I'd like you to access an online calculator and put in your data so you can actually compute your own cardiovascular risk, right? Go home and we're probably at home now watching this video. Check your body mass index, which is essentially the weight divided by the square of your height. The weight divided by the square of your height. 18 to 25 is normal. 25 to 30 is overweight. 30 to 40 is obese. And between 30 and 35 is obese class 1. 35 to 40, obese class 2. Check your body mass index, right? Check your waist to hip ratio, and we've covered how to do this. Anything above 0.9 if you're male and above 0.8 if you're female portends a higher cardiovascular risk. And use the tools we have discussed to improve your cardiovascular and overall health. And I hope you'll just allow me to encourage you from scripture regarding well-being. Alrighty. The book of 1 Timothy chapter 4 verse 8 here, Paul is addressing Timothy. And he says, for physical training is indeed of some value, but godliness has value for all things, holding promise for both this present life and the life that is to come. The book of Proverbs 4:23, Solomon admonishes us by saying, above all else, guard your heart, for it is the wellspring of life. So I think this can be interpreted in both a physiological context as well as a spiritual context. The physiological context being God has blessed you with only one heart. And it's up to you and I to decrease our cardiovascular risk and take care of your heart. Remember, your heart never stops beating from the time you are born till the time you are called away. So I pray that we will all take care of our hearts, both physiologically and spiritually. God bless you, everybody. These are my references. I'll see you soon with another handy video on my channel. Have yourself a wonderful day. God bless you.